Physicians group opposes plan to treat gun crime as a public health problem. Of course, public health is going to do this. Globalists. Yeah, they want to treat everything the same thing they did with racism in 2020, that systemic racism is the new public health crisis. As I've said, this is what the founders feared, was people that say they're about health and safety and we're coming to help and save you. We're going to have to restrict your rights, and we're going to do that under the title of public health, of health and safety. So what's really disappointing about this, not that everybody is for taking away legal guns, but, well, is that until the higher educated, many of them, until they want to see how bad their enemy is, okay? Because this enemy is not just at me. This enemy is at doctors, nurses, many people, every American, really. Until people want to see the truth about what the links this enemy will go to take away American citizens' guns, then they're not going to come to solutions. So yeah, public health, they need to be dismantled, let's face it, because this is totally out of their lane. But this is what the World Economic Forum and, well, the World Health Program is all about. Yeah, it's about using all this stuff. This is a safety thing. So Doctors Megan Ramney and Robert Young think that gun crime is a problem, but they can't agree on a solution. Okay, so here's the solution. If you try to take the legal guns away, or public health does, there will be a war. There will. I don't know why the left and the lunatics will want to push this. Well, you know why they do. Because once, it's already been proven in history, once you take away the people's guns, then tyranny gets worse. Yeah, that's the reason people in this country, they'll go to war before they give you your damn guns, okay? Because it's the guns that are killing people are the ones that people get illegally, okay? And so that's still going to happen. So this shouldn't even be a discussion. Again, this is an amendment right. Our founders wanted every citizen to be armed. Yeah, crazy, huh? But they did. They didn't care what public health had to say. They wanted citizens armed so that in a last resort, if tyranny had gotten so deep, like what we're living under, so embedded in everything, that the American citizens themselves could throw off the government and keep the constitutional republic in place. This is why all this bullshit about guns is ridiculous. As physicians, they have both dealt with grievous gunshot wounds. They've seen families and communities devastated by criminals with guns. They agree that more can and should be done. Okay, well, as long as we have gangs, and we'll have gangs as long as we have criminals in the White House, criminals in Congress, all over there. Yeah, then and at your local level, then yeah, if you defund the police, then doctors, I'm just saying, you have a bunch of cities that defunded their police. People are running into stores, into malls, stealing thousands and thousands of dollars of things. People are videotaping it. And in democratic cities, they're allowed to do it. So with politicians that allow that garbage, this is the problem. The gangs could be handled. That would reduce the gun crime. It's as simple as that. But the politicians we've had, the left and the right, they don't ever want to do anything about it. Just like they don't want to do anything about the homeless population or the drug addicted population on the street, because they get a kickback for looking the other way. So, I mean, this is ridiculous to even have these discussions. You got to get to the root. I keep saying it. You got to get to the root of the problem in order to fix it. Just talking about these, they're not even seeing who the true enemy is here. Dr. Ramney wants to treat the problem as a public health issue. Okay, so you're a globalist, Dr. Ramney. It is not a public health crisis. Please get out of your lane. Get back in your lane. Okay? Public health, get back in your lane. Public health, you doctors are not going to come along and decide and convince everyone that we need to give up guns. That's exactly what they want. And maybe you want it, but let me tell you something, you won't be happy if that happens, because no gun owner, legal gun owner in this country is going to give them up, not even in Illinois. because they tried to pass laws here. Look, I live in a state where they have the tightest and strongest and strictest gun laws. And has everybody seen every weekend how many deaths, gunfire there is every weekend? I mean, been going on for years, the deaths in Chicago. Yeah, because it's gang violence. So doctors, until we have politicians that actually work for the people, you're not going to fix this, okay? It's just as simple as that. Because the politicians want the gangs in place. Because it serves them. It keeps people down. It creates chaos. We don't have leaders that have anybody's best interest at heart. We haven't. So Dr. Ramney is clearly not someone thinking, or she's just a globalist, or he, who knows. Dr. Ramney is the dean of the Yale School of Public Health. That says it all. There you go. Says it all. Yale. Yeah, of course, Yale. Yeah. So globalist. Yeah. Did you come out of Skull and Bones or Scroll and Key or Book and Snake? One of those secret, 10 secret societies alone that are at Yale that have millions of dollars in their trusts. Yeah. So that explains a lot. We know who Dr. Ramney is then. From Yale School of Public Health, and a former emergency room doctor. On November 28th, 2023, she told a hearing of U.S. Senate Committee and Judiciary that her emergency room experience made the solution clear. Well, I know you don't have the right solution, doctor. No, you don't. But are you really, if you came out of Yale and you don't know who, again, if it's just a matter of if it's just a matter of innocent doctors, and I'm sure there's many, they need to get to the root of the problem. You're not going to get to I read that this is not getting to the root of the problem. The gangs in all cities, all that stuff could be handled, all this violence could be handled very easily. But it takes having politicians that are not bought off or really that come out of Yale. Too many of the Yale elites are in Washington, everywhere. So, according to Dr. Ramney, the solution must involve strategies that have been used to address public health issues such as deaths from car crashes and heart disease. No, Dr. Ramney, I think really what you're trying to do is you're just trying to use public health, and I'm sure you consider yourself an expert, right, from that Ivy League school, yeah. So you're just trying to use public health and bring in more tyranny, such as deaths from car crashes and heart disease. She recommends a 4-step process of gathering data. Oh my God. Determining the scope of the problem. No, the problem is we need people that will address the gangs. Then you won't have, it's simple as that. You don't need to have a blue ribbon committee, sit around, collect data. No, you don't. Because it's been going on forever. There's simple solutions. That's why I can't stand these experts. Because their idea is, well, we need to collect data and then we'll have to put a committee together. So we're going to need funding from the taxpayers so that we can research this for the next 50 years. And then every solution we'll come up with will fail and everything will get worse because they don't want to look at the true problem. And the problem is the gangs, the violence, all of it is easily taken care of. There's easy solutions here. But not as long as you have Yale people from Yale that are politicians running everything at your local and federal level. They want to keep the problem in place because it benefits them. It does. I know that's maybe a hard thing for some people to believe, but it's the truth. It's very hard to wake up to the fact that you think that all Americans are the same. They are not. There are some people that want to do nothing but take every American's rights away, and they will use public health to do it. They showed that in 2020 when public health and the nursing and medical profession decided at the top, our new public health crisis in the middle of COVID is systemic racism. You'd think they'd walk that back by now since, the George Floyd thing, even though they put him up on some idol, he died of a fentanyl overdose. But public health hasn't seemed to let that one go, no, because it serves them to create a race war. In America, firearms are now the leading cause of death. No, communism is. Just worldwide, really, it is. But okay. Cause of death for American children aged 1 through 19. Yeah, so I'm not even going to read any more of this because I'm out of time, but it's very simple. We need politicians that are not from Yale, and we need people that actually have a heart and can see where the true root of the problem is and aren't busy doing a bunch of committees and data. There's simple solutions to all this, just saying.